coronavirus to be reported today. All of them are linked to the current outbreak, so that's 72 active cases in total. One of those cases was isolating throughout their infectious period, and the Chief Health Officer will speak to that trend and what we hope to see more of that in coming days. There are 15,800 primary close contacts who are in quarantine that are isolating at home or in another place which we have supported them to secure. So that's the best part of 16,000 people who, to protect all of us, are staying at home. We thank them very much for them being compliant with the orders, with the requests that have been made of them. That's no small thing, and we're very grateful to each and every one of them. There are now 250, in fact more than 250 exposure sites that are connected to this outbreak, stretching from Phillip Island to the Mallee. This is from one end of the state to the other, literally, not just in Melbourne, but indeed right across our state. That is very challenging. The good news, though, is that there were just under 55,000 tests, the results of which were received and are in these numbers. So that's 55,000 people, close enough, who have queued, who have waited, who have played their part in not only keeping their family safe, but keeping every family safe. And we're deeply grateful to each and every one of those, as well as the many staff playing many different roles to bring this outbreak into, to get that sense of absolute control over this outbreak. We're not there yet, though, and I'll come to that in a moment. Just on Mildura, we believe this to be the first case of coronavirus in that community since March last year. So this is challenging for the community of Mildura. We've put on some additional testing capacity, a pop-up clinic at the rec centre. I would not necessarily call for everybody across Mildura to go to that testing centre. If you need to get tested, then someone will contact you. Or if you have symptoms, of course, go and get tested. But we're not moving to community-wide testing up there just yet. And if everybody turns up at that pop-up, then obviously there will be very long queues, and we don't want that to be the case. It's a much more targeted effort, but it is additional effort, and we're also supporting the Mildura community in lots of other ways, whether it be speaking with local government, speaking with the health service, working through all of those different issues. There's no need to be alarmed in that community. Just work through these things in a diligent way, and we'll get the results, we'll get the facts, we'll deal with those things, and we'll provide support to anybody who needs it. That testing number is very strong, though, another day of more than 50,000, so we are very grateful. And again, our message, as it has been the case so many days for such a long period of time, any symptoms whatsoever, please don't wait an hour, please don't wait a day. Go and get tested as soon as you possibly can. Our overall testing capacity is holding up quite well. We will get your results back to you as quickly as possible, and you will have done a very important thing, a great service for your fellow Victorians and indeed for yourself. If you've got this, then you want to know so that you're not doing anything that might spread it to those you love and indeed to those you will never meet. Of the 15,800 close contacts, I want to just run primary close contacts, I should say. I just want to run through those and the testing results and the performance across each of those, and it gives you a sense that this is by no means over. We are running alongside this virus, but we are not yet out in front of it. And if you think about it like a fire, we've got a containment line, we're making significant progress, but it's not out yet. And what we know with Delta is an hour's like a day and a day's like a week in some ways. It's moving so fast. We see in Sydney how fast it's moving, and indeed right here. If it's smouldering, then it will run again, it will take off again. And that's the great challenge that we face now, and the challenge that we'll face in the days ahead. But just quickly, more than 3,000 of those 15,800 are linked to the MCG. We have about half the test results back from that group of people. At Amy Park, we have 1,800 close contacts, and again, about half of those have been tested and their results have come back to us. At Trinity Grammar, we have 2,300 close contacts, 57% of those results have come back. At Bacchus Marsh Grammar, about 2,700, and around 76% of those results have come back. And finally, at the Miss Frankie restaurant, there's about 540, and we've got about 63% of those results have come back to us. What that tells us is that there's still many tests to be taken, many tests that are in the labs, and we won't get the results of those. We don't have them now. We'll get them over the course of today and probably into tomorrow, plus all of those other Victorians who will go and get tested for the best of reasons. What I want to make clear to all Victorians is we have made great progress. We have avoided thousands of cases. Knowing what we know now, lockdown was the right course. That was the right call at the right time. It was and remains very challenging, but we will not be ready to lift this lockdown at midnight tomorrow night. I know it's frustrating that I can't stand here now and tell you exactly what rules and what time frame will apply beyond midnight tomorrow night, but we want to just to explain why that's the case. The Chief Health Officer will provide advice to me and my senior colleagues. That will occur overnight tomorrow morning, and it'll be based on the best information, the most complete set of facts that we can possibly pull together. That means the results of today's interviews, the results of today's testing, the results of tests that are in the lab now. All of those things will be taken into account, and we will make a decision that is in the interest of all Victorians and in the interest of avoiding what is occurring in other parts of our country. We do not want that to happen here. And I think that knowing what we know now, having seen what's unfolded during this lockdown, these last 4 days, we know that if we had been open, then we would be just like Sydney. We would have hundreds and hundreds and hundreds of cases. And we would not be looking at a short lockdown, we'd be looking at something entirely different. We wish them well and we want them to be as successful as possible, as fast as possible, because if there's a problem there, then there's an ongoing challenge for all of us. But we will not be, I'm sorry to say, ready to lift these restrictions at midnight tomorrow night. To do so would not be the right thing to do. It would be perhaps a few days of sunshine, and then we'd be very high chance we'd be back in lockdown again. That's what I'm trying to avoid. We're trying to make sure we do this properly and bring these cases to an end, close off those chains of community transmission, and then open with a sense of confidence that we can stay open. I know this is not the news that people want to hear, but you've got to do the right thing. This thing is moving so fast, it's so challenging, it's so dynamic that we have to be on our guard, and we have to make sure that we make the best calls, because you only kind of get one chance to do that. We do not want to be back and forth, having not dealt with this outbreak, sort of fooling ourselves that we have. That's why getting tested if you've got symptoms, complying with the requests that are made of you. If you're asked to isolate, please do that and nothing else. If you're asked to test, please do that. All of our contact tracers and the whole team are working incredibly hard. They have achieved a lot in these last 4 days, and as a community we have avoided what would almost certainly have been the case. Hundreds, if not more, cases, and not running alongside this virus. It would be so far out in front of us that we would be standing here today having to forecast for Victorians weeks and weeks and weeks of lockdown. We have avoided that to this point, but we've all got to keep working hard. When that data comes in, when the advice comes in, I'll be out to speak to you and through you to the Victorian community as soon as I have that, as soon as a decision is made, and I hope that can be as early tomorrow as possible, and then people across the state will know what rules will apply and for what period. I just again confirm, as I have done so many times, I'll have these rules on. This lockdown will be on only for as long as it needs to be, not a moment longer, but I don't want a situation where we fail to extinguish this, we fail to end these chains of transmission, only to open and then be closed again a short time thereafter. That is not right. That is not the way to go. As for things in New South Wales and the ongoing challenge we face, I did make the point yesterday that even once this outbreak, as complex and as challenging as it is dealt with, unless and until case numbers in Sydney dramatically reduce, we're going to have an ongoing challenge in terms of defending that border to the north and making sure that nobody who has this virus is coming to our state. That's for another day. That's principally our challenge, but again, we'll be calling on the community to play their part in that for a lengthy period of time. That's just the reality that we face. I hope we can face that reality, and I'm confident we will face that reality open as opposed to closed, which is where Sydney finds itself now and for the foreseeable future. We wish them well. There's no sense of criticism. We wish them well. If they have a problem, then the whole country has a problem, and that's why we wish them well in their efforts. All in all, can I just acknowledge that I know it is frustrating for people to listen to this and know that these restrictions simply cannot end at midnight tomorrow night. That would not be the responsible thing to do. That'll only see more and more of this virus spread, and all our good work over the last 4 days, and by then 5 days, count for nothing. I just won't do that. Whether it be popular or not, I will not put at risk all that we've given in this most recent lockdown, and it's been successful. It has worked, but it's going to need to work for a while longer. As soon as I can confirm for Victorians how much longer and in what circumstances, I will do that, and I hope that will be around this time tomorrow, or certainly as early tomorrow as possible. Now, to take us through, before I ask the Chief Health Officer to speak to the details of those cases that we've announced today as additional cases, and he also has some promising news in relation to some other cases that are on the board and the circumstances in which they've come forward, but after midnight but not counted in these numbers. I'll be in tomorrow's. I just again want to thank every single Victorian for the part they're playing, the work they're doing. We as a community can be very proud that we are the only jurisdiction anywhere in the world to have dealt with a Delta outbreak. We did it a few weeks ago, and we will do it again with this one. The signs are positive, but we will need more time to be certain that when we open, we can stay open. That's always been what's guided us. We've gone hard and early, and I think we have avoided, in fact I know we have avoided, something altogether worse. Altogether worse. That's weeks, if not months, of being closed. We know what that's like. We don't want to go back to that, and I'm determined to do everything I can. There are no guarantees, but I'm determined to do everything I can to make sure that that doesn't happen. To take us through those cases and the circumstances of them, I'll ask Brett now to make a few comments, and then we're happy to take any and all questions you have. I will, just ahead of any of those questions we can't answer, there'll be like a show release, an update later on today. I think further information will be provided to you in more granular detail a bit later on today.
Thanks, Premier, and good morning. So just on today's numbers, there's quite a bit of detail here, so please bear with me. 13 new locally acquired cases today. One is the case who contracted the virus at the MCG, who's returned to Mildura, so our new Mildura case. There's another who is his household contact, so that's 2. 4 additional cases are linked to Miss Frankie, all who dined at the venue, so that's 6. There are 2 more linked to Trinity Grammar, another 2 students, that's 8. One is a social contact of the Phillip Island case, so that's 9. One is linked to Amy Park, I'll speak more to that shortly, so that's 10. Another one linked to Young and Jackson's, that's 11. One is linked to the Bacchus Marsh Grammar, who was in isolation during their entire infectious period, that's 12. And one is our first case emerging from the Euro finals event at the Crafty Squire, so that's 13. That final case at Crafty Squire is of concern. It is absolutely an example of how quickly this variant is moving and the short time we're seeing between exposure and then being infectious and onward transmission. Previously, last year, we would not have seen any circumstances where someone who'd been exposed was transmitting to someone else a day and a half later. Less than 48 hours later, simply was not seen last year with other variants. And so while we acted as conservatively as possible in declaring Crafty Squire a high-risk venue, we didn't necessarily expect there to be transmission there. So the fact that it's occurred some 30 hours after being exposed is absolutely a feature of the Delta variant. This is not the only circumstance where we've seen that rapid transmission from exposure to onward transmission. So anyone who is present at the Euro Finals event at Crafty Squire in the early hours of Monday, so from 3 a.m. to 8 a.m, must isolate, get tested and quarantine immediately for that full 14 days. I also want to talk briefly about MCG and Amy Park. You will have noticed that we're updating what we call the contact definitions for these sites, Tier 1, Tier 2, etc., based on new information we've found in the course of our investigations. When information changes, we have to make those changes to our approach as well. It's the right thing to do, and it relates to new information that tells us about risk. In previous outbreaks, even last month, we've had cases at MCG and Marvel Stadium in seating areas with no onward transmission at all. But we are seeing transmission between strangers, including those who didn't sit near each other, including people who sat outside for their entire time. So we're expanding the number of primary close contacts from the MCG. Just to remind you, primary close contacts from the MCC Members Reserve for the Carlton-Geelong game are those who attended Percy Beam's Bar between 4 and 4:30, and then again between 5:20 and 5:50 p.m. People who entered Gate 2 between 3:53 and 4:06 p.m. That's been upgraded by just a few minutes, 3 minutes to 4:06. People seated in sections N40 to 46 on level 2 of the Members Reserve. That's been extended from sections N41 to N45, and our Mildura case was at the margins there, and that's why the extension of these sections has occurred. Again, normally you wouldn't see transmission out in these areas. And others identified as having close contact with the confirmed case who are present have obviously been contacted directly. If you're a primary close contact, you need to immediately isolate, quarantine, get tested, and have that 14 days in quarantine following your exposure. You can call the department on 1300 651 160. Other than for the above, all other areas of the MCC Members Reserve remain at Tier 2 sites, so that's isolating, getting tested and remaining isolated until you get that negative result back. Then you're free to go about your normal business. It's true to say if you develop symptoms at any point after that in the 14 days from exposure, you should get tested again. If you're on level 2 of the Members Reserve at any stage and have already had one test, I am requesting that you obtain a second test when possible following your first test, again reflecting that upgraded risk. That's really out of an abundance of caution. If you don't have symptoms, you don't have to isolate while awaiting your second test result, but if you have any symptoms at all, you have to remain isolated until that negative result. We're also expanding the number of close contacts and Tier 2 contacts at Amy Park. Today's Amy Park case was seated in an area of the ground that was not anywhere near the initial case in question. We think that transmissions occurred at the pinch point on entry. As a reminder, our definitions of Amy Park were if you were seated in sections 22, 23 or 24 in Zone 2 on Level 1, or if you entered Gate 7 between 7:56 and 8:13, then you had to isolate, get tested and quarantine. And anyone else who entered Gate 7 or anyone seated in sections 25 to 42 are Tier 2 contacts who need to isolate, get tested until they get that negative result. Based on this new case, we're now also declaring sections 81 to 91 of the grounds as Tier 2 areas, requiring you to get tested and isolate until negative. And there's a map on our exposure site's website of the ground which highlights those areas that I've just discussed. So just to reinforce the message from the Premier, Delta variant is hugely challenging. It is an absolute testament to contact tracing that all cases thus far have been linked. I don't think there's been an outbreak of this size in Australia where all cases have been linked. It is a testament to the, sometimes 3 hours of interviewing that are done with cases to look at each and every exposure site that they've been to. That is really helping us make sure that there are no cases of unknown acquisition out there where they're transmitting to others unwittingly. So we are able to chase down these cases much more effectively knowing that. But it's still hugely challenging. Those 30 hours between exposure and onward transmission makes it extremely challenging for our contact tracers. Yes, Victoria defeated the Delta variant in the last month. We were in lockdown when we did that. There is no other jurisdiction in the world that has driven a Delta variant back down to zero. Singapore, which I would have thought was one of the best placed in the world to do so, are now battling numbers that are akin to New South Wales. We've seen modelling in the public space from New South Wales and Victoria that means that there might be ongoing risk north of Victoria for weeks or months to come. We don't want to be in that position. There is no absolute guarantee that we can win against Delta variant. We have to give ourselves the absolute best chance. but we have to recognise just how profoundly challenging it is with this new variant. It is not a question of locking down for a short period of time versus life as normal. Life as normal puts at risk hundreds of cases becoming thousands of cases, becoming tens of thousands of cases. So these are awful and difficult decisions, but we cannot pretend that it's simply a choice of locking down or not having to worry about it. This will take off if we allow it to. We do have to extinguish each and every chain of transmission because even in places across the Northern Hemisphere with high vaccination coverage, yes, they're decreasing the number of deaths that they're seeing, the pressures on their hospital system, but it's still ramping up. Even as the UK experiences Freedom Day, as they're calling it, 50,000 cases per day. They are expecting 200 deaths per day to potentially occur as they go into their next exit wave, as they call it. These are profoundly challenging times with this virus, in particular the Delta variant. We have to win, we have to extinguish it, and we need that assurance through an additional period to be determined to make sure we get there. Thank you.
I'll just very quickly talk about what we're trying to avoid. This thing moves so fast and is so wildly infectious that if we were just to let it run, to say this is all too hard and we're going to pretend that it's over even though it isn't, then look at Sydney's hospitalisation rates, look at the otherwise healthy people in quite young age groups who are in ICU. Look at the rest of the world. We will finish up with our hospitals very full. And the notion that, oh, well, a few hundred people on machines to breathe, why can't we cope with that? Well, the challenge with that is that that's where it starts. It gets much worse than that really quickly. And then, of course, there's all the people who require our hospitals for non-COVID reasons, who will not be able to get the care that they need if we were to allow it to run. That is not an option that is available to us. So the choice really is a short lockdown or one that's much, much longer, because it gets away from you and we don't have enough people that have had the jab. And then we have to fill in the space between now and September, October, November with a lockdown or a series of lockdowns. We are doing everything we can to avoid that. And the one bit that Professor Sutton didn't mention, we've got 4 on the board, which we'll report tomorrow. All 4 of them have been tucked away in ISO for 100% of their time. That's a trend we want to see continue. That means that those people, yes, they've been infected and we have to support them. We don't want any cases. And there's no such thing as having a good case of this. But those people have been away and are no risk to public health because of their infection. That's a triumph of tracing. It's a triumph of people, doing the right thing and us getting to this early. It's when people have been out for days and days and have almost certainly passed this on to others, particularly if you are open or too open, that's when you lose complete control of it. We have avoided that. We have to make sure that we continue to avoid this thing running wild, and I'm determined to do that. I know it's frustrating. I know everyone would love to have a timeline and absolute certainty right now. One thing we can be certain of is we have, through the sacrifice and the effort we've all made over these last 4 days, we have avoided much, much worse, and we are very well placed to be able to run these chains of transmission into the ground and then get back to normal as soon as possible. Those details, based on the best advice, which is formulated from the best and most recent, most complete picture, so test results coming back rather than leaving them in the lab, get the results and make a decision based on that data. That'll happen overnight. It'll be a very long night, and we'll be out to see you tomorrow to give you and all Victorians that certainty.
On your current modelling, maybe one for Brett, if you wouldn't mind, Premier.
Sure.
How much longer do contact tracers need to get their arms fully around those that are not in isolation, essentially?
Yeah, firstly I'd say we're not in a position this morning, and that's why I'm acknowledging that it is frustrating, and I know people would love to know exactly what's going to unfold for the rest of this week, and if we could provide those details now, we would. We're just being clear with people, 24 hours or a bit more than 24 hours out from the scheduled end of this snap lockdown, we can be clear that we will need more time. Exactly how much more time, that advice is not with me yet. No decision has been made about that, because those decisions will be made based on advice, which is in turn based on the most complete picture. There are literally, as I read out all those test results from people who are close contacts, so do they become cases? and that's a really important point. Are there additional cases that come forward, additional change of transmission venues? Are there additional challenges that will unfold overnight? We can't know that until tomorrow morning, and then we will make a decision, and then we will share that with people and be as clear as we possibly can.
So just to Brett, sorry, George, can I just get Brett on that
Yeah,
point,
sure.
please?
I'm pretty sure. Yep.
So
we're not
knowing-
able to tell you today
I know.
what we will tell you tomorrow.
Can I frame it in this way? Knowing what you know about our contact tracing team's capabilities, the current level of exposure sites, and how much this could go up in terms of the curve, what is your best advice to the Premier at the moment?
I can't give you a specifics around time required. We've only got 4 days of experience of our lockdown so far. We are just beginning to see the real benefits of that lockdown in terms of the cases that are emerging today. So we do need the remainder of today and whatever happens overnight to be able to make that full assessment. It's not a question of contact tracing capacity. We've got the best contact tracing capacity out there. It is absolutely a question of how tricky it is with a variant that is so infectious and moving so quickly.
With the one that's in isolation today, I believe it's 4 that will be reported
4
tomorrow.
on the books so far. We'll have more,
Yeah.
there's no question.
Yeah. How is the trend though over the 5 days, just on that key marker? Because the Premier said on Thursday, that's the key marker, the number of people in isolation. What's the trend been like over lockdown?
Look, it is an improving trend over time. We are seeing people who, yes, they're out in the community for some of their infectious period, but it's becoming a smaller and smaller period of time. I think I spoke to 1.7 days average for cases the other day. It stayed like that yesterday. We're probably looking at a shorter period now. The initial test results we're getting back from people also have higher CT values, which means lower viral loads. So we're probably picking up people earlier in their infectious period as well, which means they're less likely to transmit to others. That's another good sign. But these are all separate elements that need to be considered in full over the course of today.
Do you have any further info on those 4 new cases?
No, not at all. They are just numbers on the books at the moment from my
Isolation. We've been in lockdown 5 days now. Why is it that the lockdown is not having the effect of having people in isolation from their infectious period? Does it mean we're still picking up a lot of cases from transmission events pre-Friday?
Yeah, so certainly that. We're picking up people who've still been to events pre-lockdown. But also you have to remember that lockdown reduces the number of exposure sites that people have been to. It reduces the number of unique close contacts they have. That's very useful from a contact tracing and transmission point of view. It doesn't stop people from going out for food, going out for other essential reasons. And so it's only when you identify people and tell them that they have strict quarantine, where they do not leave the house, do not see anyone else, do not open the door to anyone for any reason other than emergency reasons, that you've got a true quarantine period for someone. And so that requires you to identify those primary close contacts and get ahead of the virus.
Chief Health Officer, we have some idea of the lay of the land now in terms of our COVID outbreak. So what are some of the options that are being considered about the extension of this lockdown?
To be announced tomorrow.
Was the person with the gruffy squire a worker or a patron at the Euros final?
A patron.
And same with the Young and Jackson, was that a patron? Or
I believe so, yeah.
And is the new Bacchus Marsh case a teacher or student?
A student, I believe, but we can
Just
check
on
on
the case that went to Mildura, can you just confirm why you've asked people that went to the MCC to retest? Is that got anything to do with the case that went to Mildura?
Yes, so that individual was at the margins of that outside area that I've listed, right near Tier 2 areas. Our Tier 2 advice is get tested, isolate until you get a negative result. Because we've got transmission to that individual, we do want people who are in that Tier 2 area to retest to really make sure, out of an abundance of caution, that they have not picked up the virus. We cannot make the whole of the MCG a Tier 1 site, quarantining tens of thousands of people and overwhelming testing with tens of thousands of people. That would be overreach. We think the risk is very low, but we do want people to recheck with another test.
Did the Mildura case, just on that, did the Mildura case...
How long was this man infectious in the community?
So to be determined, there are interviews ongoing. Had an initial negative test. That was a true negative test. I'm aware of rumours about it being a false negative. It wasn't a false negative. It's been retested. It was negative, but a subsequent positive test, we would go 48 hours before symptom onset. There are some new exposure sites by virtue of that.
Sorry, are there enough testing kits in Mildura? We're getting reports you've run out.
There are additional supports coming to Mildura. The Premier has some details.
So there's a pop-up clinic that has been established at the rec centre, and I know that Jerome and his team, the whole team, are in regular contact with the hospital, with the public health unit up there. Whatever we need to provide, we will. We know this will be challenging for the Mildura community, not having had a case, but we're right there with them, working as closely as we possibly can. I have no advice to that effect. In fact, we've added to the capacity, which is really important because we want people who've got symptoms or others who are directed to get tested. We're not inviting the entire community to get tested as we did with Shepparton, for instance, last year. We hope it doesn't get to that. So we don't want people to flood the place. That can be very challenging for a number of reasons, but I understand they have what they need. If they need more, then of course we will provide that. Everyone will get a go. We'll be here for as long as we need to be here, as we are every day. Julia.
On the Mildura case, was
Yep.
that man doing anything wrong? Was he supposed to be in isolation?
Don't believe so.
After going to the MCG?
I don't believe so. I think he's done the right thing. He tested negative. He's then had symptoms. He's gone and presented for care, been retested, and he's getting the best care that he can be given.
Was he isolating immediately after that level 2 members reserve was listed as an exposure site?
I'm not certain about that.
Based on what people can... Sorry, Julia.
Did you gauge that from the interviews yesterday?
Well, I'm not confirming that. I'm not briefed on that, and even if I were, I wouldn't necessarily, for a whole range of reasons, go into the details, the very clear details that may well identify somebody. And I think everyone knows, for the best of reasons, we want people to come forward, tell a full and complete story without fear that they're going to be punished. The value of the information far exceeds any penalty we might impose on them. I'm not commenting on this individual case. I'm making a broader point. And that's why we're sometimes a bit guarded in all the different information that we give you around individual circumstances. We want people to come forward with confidence. But I have no advice that he was doing the wrong thing.
He has put the community at risk.
Is closed because it's at capacity. Will you open another centre or send
Yeah,
more?
sure. If there's more testing capacity that's required to get the information that we need, then we will open up further. Whether it's hours, different sites, all of those things will be done as soon as we possibly can. I think there's every support being provided. If more needs to be done, though, then of course we will, just as we have done with communities right across the state.
Can we just ask about what people might look for?
Why don't we go to Raf and then Simon? Raf.
I know you can't say when the lockdown will lift.
Sure.
But people want to know what they can look for about, what sort of indicators.
Of
Are
course
you
they do.
waiting until there's no
Raf-
new trains of transmission?
Yeah, look, Raf, I live in a family too, right? I'll go home after this and do my, many meetings from home today because that's the right thing to do. And my household will want to know what's going on. Everyone wants to know for the best of reasons. I could guess at it now. I don't think that's fair. I think the best thing to do is to act on advice, particularly when you're confident that the advice is formulated from and comes from the best and most recent and most complete picture of what the virus is doing. I appreciate more than most that's very frustrating because I've had to stand here doing this kind of, I can't tell you now, but I will tell you as soon as I can a number of times. It has served us well, waiting for thousands of test results to come forward. I know it's frustrating, but there are many frustrating things about this. This is one of them. What I think would be more frustrating is if we were chasing the popular thing, if we were not prepared to do what had to be done. We've established as a community, all of us, not politicians, as a community, we will do what has to be done to put this out. Tomorrow night's not going to be enough. We're going to need to do more. As soon as we've made that decision, I'll be out here explaining to you why. In terms of your issue about what will guide us, number of cases, chains of transmission, mystery cases, we don't have any at the moment, they're all linked, that's a very positive sign. It's almost certain that we would have mystery cases if we'd not shut down last Thursday night, almost certain. All of those things, all the things that have always guided us will guide us again, but it will be off tonight's data and some stuff that will come in the morning, and then we will report our progress.
Just on the border itself, no one wants to keep doing this until you don't want to keep doing the lockdown. Is there any way that Are you considering either hardening the border on the Murray in some way, or is there any way it is feasible to send maybe the second dose contingency up to those border towns? Can you send more vax to the border? Is that a crazy idea, or could that help to stop the virus coming back in?
Well, notwithstanding the Mildura issue, we don't have a problem along the border. That bubble is operating well, and I know that locals in those communities take their responsibilities very seriously, and they want to maintain that freedom of movement for all the reasons we've talked about many times: healthcare, education, all those sorts of things, right? So it's not like I think we've got a problem that's particular to that area, to that bubble. It's more a matter of people flying over or driving through that bubble and potentially unknowingly coming to Melbourne and bringing the virus with them. Again, I want to be very clear. In anything I say, I'm not running a commentary or a criticism or a grading of New South Wales. We wish them well, only good things. Because as soon as they get it under control, that takes a lot of pressure off us and Adelaide and Brisbane and the whole country, right? So just in terms of the border, I'm not here today to make announcements, but we are actively looking at what more we can do. It's a pretty hard border now. Our police they're using technology, drones, choppers, they're doing all random stops, they're doing all sorts of things, and overall compliance with the permit system has been very, very high, very high. But I certainly can't rule out further changes and further limiting movement from New South Wales to Victoria. I see a further case in regional New South Wales today. I think that just confirms that we made some tough calls about all of that state being a red zone. That's not easy. We know that dramatically inconveniences lots of people, but so too does this virus travelling. It's got to be pulled up in Sydney. It just has to be. But our job in the first instance is to pull it up here out of this outbreak. The cases started in Sydney. We've got to end them here, and that's what we're determined to do. And then we'll have to look at the border and if there's anything further we can do. But we come off, I just want to stress, a very high base. And I've had discussions personally with the Chief Commissioner about this, and he's happy with the way things are going. But if there's anything more we can do, then of course we won't hesitate to do it.
What's your message to regional Victoria at the moment? You did say on Thursday you try and release some regions.
That's simply not possible, and I think we see cases. We started with cases in Barwon Heads, Balan, Bacchus Marsh. We then had cases Phillip Island. We've had a case up in Mildura, and we have many exposure sites and many people who are close contacts who are isolating across regional Victoria. This is an outbreak that has touched all of us, and therefore the rules have to. If I could release parts of regional New South Wales, if I got advice to do that, then we would absolutely do that. I don't have that advice because it wouldn't be safe to do that. I'm not going to, for the sake. Plus, the other thing too is that whenever you have different rules, and the easiest thing is for a whole lot of people on the other side of politics to be, making pretty cheap points about this. This is serious. It's important that we protect people and keep them safe. I don't want a situation where, for the sake of being popular for a short period of time, you let it run in a regional community, only to have a situation where Melbourne is coming right down and can reopen, but we can't because we've got a problem in many different parts of regional Victoria.
So it's fair to say the whole state's matched up now in terms. Sorry, just on that point.
Well, there is a threat. There is a threat across many different parts of the state, and that's based on what we know. We never assume that we have a complete picture. There's always things out there, particularly with this Delta variant, that you don't know. As to the rules that will apply beyond midnight tomorrow night, I will make those announcements tomorrow. Again, I appreciate why you're asking the question, and I have an acute understanding that everybody who's watching and listening would love to know what's happening after midnight tomorrow night right now, but I'm just not in a position to provide that clarity. I will be tomorrow.
Well, the city and the regions.
Are we confident that we've got in touch with everyone who was there? I think there was some worries about not everyone checking in and tickets being sold.
I believe that we've made every best effort to reach out to those people who had purchased tickets to a ticketed event on behalf of others to get them to contact those they had purchased tickets for. I think perhaps Jerome and others might be able to provide further information about that later today, but we haven't got to necessarily all of them yet. We're chasing and chasing. That's the nature of this. It's literally 24/7.
And is that one of the biggest concerns at the moment, considering this happened a week ago, so those people have been out in the community for a week?
Yeah, anytime you've got people who, given how infectious this is, you have to assume that they've got it. And anytime you've got them out in the community for a lengthy period of time, that is a real challenge. But not to be completely negative about it, the other side of that coin is that as we get to people and they do the right thing and do as we ask and lock themselves away from others, we start to see hopefully a trend like those 4 cases that are on the board already that were in ISO for the entirety of their infectious period. We want to see more of that. We're confident we will. Well, we can't be certain until those come through.
Premier, given those regional cases, do you think that the city and the regions will be in this extended lockdown together for the whole course of it?
At this stage, it's too early for us to say. Other than to go back to the point I've made many hundreds of times, Victorians, whether they're in the suburbs of Melbourne, the centre of the city, a big regional centre, or the smallest country town, you'll be in this lockdown no longer than you need to be. No longer than you need to be. It's as simple as that. I want us open. I want us to resume that economic recovery that leads the nation. Our plan for jobs, as outlined in last year's budget and this year's budget, is having a fantastic effect. I know this is challenging. And recovery is a long-term thing. We want to be out of this lockdown as soon as it's safe to do so. What we can't have is unfolding in Melbourne or in any part of Victoria what is unfolding in Sydney at the moment. Now, they are a long way off from having the sorts of debates and discussions that we're having today, and I want to keep it that way.
And on this Mildura case, he presented to the emergency department.
Yep.
Do we know more about his condition?
Not that I can update you on, but we might be able to, within the realms of his privacy as a patient, give you a bit of a sense. I don't believe he's in intensive care. But I don't. He's getting the best of care. But as to where that care is being given and some of those details, I'd be very guarded about. Not necessarily. I don't believe so. No.
Is he in Melbourne?
I believe he may be receiving care. I'm not sure how he made his way here, but he's getting the best of care. And as good as the Mildura Hospital is, and it's getting even better because it's been returned to public hands from its previous private ownership, there is always greater capacity at big tertiary teaching hospitals in Melbourne. There always will be. So I think that there's been clinical judgments made about that person. We wish him well, and we thank him for the part he's played in pulling up this virus.
How many apartment blocks?
Part of the challenge in Mildura, the fact that the nearest public health hub is in fact in Bendigo, which is 400 kilometres closer to Melbourne, and that public health response in Mildura is being run out of Bendigo?
No, I wouldn't see that as a challenge. I think we've got a pop-up clinic open there within hours of the case. We're supporting him, we've interviewed him, we're providing him with the care he needs. We'll provide anybody who needs care and support with just that. I think the response has been very quick on the ground, and I want to thank our partners for that, whether it be with the council, whether it be with the hospital. Lots of others will be part of that. So I'm not briefed that there's any challenges, there's any difficulties there. There's lots of challenges, but I think everything's being done that needs to be done. But to the point about the drive-through clinic maybe being full, if we've got to do more, then we will.
Just a question to Brett Sutton. Sorry.
Sure.
Do you have any information on the Westgate Tunnel site being an exposure site?
No, I do not. No, I do not.
Just on the 1 million Pfizer doses that have arrived in Australia today, how many will Victoria receive?
I'm not certain. I'm not certain whether there's been any additional vaccine allocated to Victoria beyond what was already on the record. That might be something we can chase up for you, though.
How many apartment blocks are currently under concern by the health department? We have heard from some residents that we're in a block in Fitzroy that they haven't been visited by the health department yet, but it's been declared a Tier 2 site, maybe
That's
one
right.
for both of you.
And as a Tier 2, it's treated differently to a Tier 1. So whilst they may appear very similar buildings, the facts of how the virus has spread, the story, if you like, of how it's unfolded is different in each of those. So sometimes an entire apartment block will be locked down. People can't leave their rooms, people can't mix amongst themselves, they have to stay in their own dwelling because we believe that there's every chance that they may well be positive and that the virus has spread within that apartment block. In other apartments that would not be locked down, we may have had concerns and doubts, but negative testing further upstream have essentially put those people into a different category. So that's why they might all look the same, they're not treated the same. And that's why I want to, again, give a shout out to people across the board. There are literally thousands and thousands of emails, text messages, phone calls, interviews going on, and information to you may change. Not just based on your circumstances, but based on the circumstances of the person or persons who you may never have met, particularly with Delta, where we've got strangers giving it to each other, if they get a negative test, if their circumstances or one of their contacts' circumstances changes, then information to you will change. And I know that might appear a bit confusing from time to time, but it's better that we're giving you the most relevant and detailed and localised story, the best information for you to go off, rather than just kind of blanket stuff. So it is as individual as it can be, and that means circumstances change.
Brett, do you have a sick rep on the apartment set? No, that's fine.
Can I just ask you, Premier, would you prioritise vaccinating teachers, looking at how many schools have been impacted this time round?
Well, it's clear that Delta is not something that schools are immune from. You know, school transmission is a real issue, and we've got a number of schools that have been at the centre of this outbreak. That's why schools are closed. And I fully acknowledge, as a parent of 2 school-aged kids, that it's very, very challenging to educate from home. It's very challenging for teachers and staff to be able to facilitate that, and it's really tough on kids. Schools will be closed no longer than they need to be. As far as who gets vaccinated and when, I don't think we've never shown an unwillingness to follow the advice on which cohorts, which groups should be vaccinated first. We've always been quick to act on that. The big limiting factor here is not advice to prioritise A over B, it's how much supply we've got. And until we get to those, to use the ADF term, until General Fruin's horizons are met in September, October and November, and we have, you know, literally pallets of this stuff arriving as we've been promised, then the current priorities will remain in place, I would think. But again, politicians don't set those priorities. They're very much based on advice.
Significant supply.
How
On
much,
that question.
Julie, do you want to go on this question?
Yeah.
Yep, sure.
But when that more significant supply
Yes.
does come, are we going to prioritise teachers, supermarket workers who are most at risk?
I think there'll still be priority, but the real question is the we in your question. It won't just be Victoria. It'll be a national decision, I would hope, so that we do something that is fair and consistent across the board. Noting that this is not just a Victorian issue or a South Australian issue or a New South Wales issue, it's very much a national fight, and the vaccination program is a national program that we are helping out with.
Just on
Paul.
the New South Wales situation, how much does the example over there influence the kind of psychology of the decision making this time around for you guys? And do you think, I mean, that outbreak's not going away anytime soon. Do you think it means that there's a long-term additional cautiousness on your part?
No, we've always been driven by the data and the facts. This is not about, from us, the psychology of our decision making. You just have to be rational, you have to be deliberate, you have to be focused never on the politics of these things or whether they're popular or not. It's about the facts and the yeah. Well, but again, we are focused on putting this out. That's what we have to do. If it's left smouldering, then it will take off again. And you know, just look at what we've found. Just if anyone doubts what we've done, just look at what we've found. Look at what has become apparent to us in the last 4 days. If we had been open, then the numbers I reported earlier are but a tiny percentage of the overall problem. And then you are in a Sydney situation because it's got so far ahead of you that you can't catch up, let alone get in front of it. You know, in any race, you don't want to give the thing a 2-lap head start. I'm determined not to do that, and that's why we shut down last Thursday night, because we are not prepared to give this thing a head start on us. We are running with it. We have to get in front of it. I'm confident we'll do that, but we're going to need a bit more time to do it.
Potentially giving the lockdown, the current effect of the lockdown, too much credence, given the isolation period of the cases that have actually occurred. Lots of them have not been in isolation. The lockdown hasn't had the effect of keeping people inside their homes for their infectious periods. So the effect of the lockdown is likely to occur as it gets longer. But so far, we're actually picking up cases that occurred well before the lockdown came into place. Are you giving too much credence to the current effect of the lockdown?
No, well, I hope you wouldn't be wishing for the alternative outcome.
I'm not.
Good. So it's not a matter of giving credence or credit, it's just what works. And having the place shut down, limiting movement, means you limit virus. We know that. All Victorians know that better than anybody. So, you know, you can find all these cases and have everybody roaming around going about their business, having like basically open, and then you get more cases. It just stands to reason. And as painful as it is, you've got to make these decisions, but you only get one chance to go hard and go fast and go early. And that always means a shorter lockdown over the life of that lockdown than if you wait. because then you get to the point where you're not locking down to get to zero, you're locking down to ensure that your hospitals aren't overwhelmed. They're two very different things. But that window closes really, really fast. We've got there in time, and I think we're seeing the benefits of that now. More tests, more work, lots of hard work and thought about these things, and we'll be back here tomorrow to give people a chance.
But just one more on what you want to see. Would it be fair to say that you're really looking for no mystery cases and 0 cases who haven't been in isolation for their entire infectious period before we open up? Would that be fair to say?
Well, that'd be the perfect outcome. That would be the perfect outcome. Sometimes you can achieve that, sometimes you can't. If you can't, then you have to make a really challenging risk judgment about, well, okay, we're just shy of that. What's the risk if we open up under those circumstances? And that's when it gets very, very challenging. But that's just the nature of the job, right? No one's complaining about having to make difficult choices. But at this stage, if you were to try and call it on those metrics, yes, we have no mysteries. That's a good thing. But we have far too many people who have been out in the community for a portion of their infectious period, if not all of it. And we've got to drive that right down. That's not dissimilar to New South Wales, except we're in a much stronger position to be able to do that. And we'll get to that outcome quicker. I think that's the advice that we have. Absolutely.
Just a second wave last year question, actually. I know New South Wales had this debate about essential work or not. What worked the most last year? Was it defining what was essential work, or was it going into those essential workplaces and checking what was going on? Which one of those things had the biggest impact?
I mean, it's always so difficult. There was a huge, complex bundle of interventions that happened in Victoria's second wave, and how you tease apart the individual effect of each and every one of those elements is hard to say. Clearly, we've tried to investigate that. We've got an understanding that there was a lot of transmission that happened in workplaces and then cycled through households. And so we know that those were significant issues. We know that mask wearing was actually more effective than we might have presumed before that intervention. It's contributed 40% in terms of the total reduction in transmission through the second wave, something akin to that. But it was the stage 4 lockdown that drove numbers down faster. The peak at close to 700 cases went down with stage 3 and masks, but it wasn't enough to get to where we needed to be come October. But in terms of exactly how you tease out what those specific interventions were, it's hard to say. I think you need to do a lot of work preemptively in workplaces to manage that risk. We saw the explosive potential in some particular work settings, food distribution warehouses, abattoirs. That's been replicated across the world, and so those work cohorts, the PPE that was implemented in food distribution and healthcare, aged care, and abattoirs, were really effective measures as well. The attestation about not being unwell when you turn up to work, and the contact tracing that gets initiated both within the workplace as we do it with our teams in public health were all elements there, but it's hard to know exactly the contribution of each.
And are you willing to tell us when and if you've spoken to Kerry Chan?
Look, I've spoken to Kerry actually while I was on leave. Always happy to pick up the phone to support, provide advice, lessons from Victoria. Clearly, our lessons were learnt in the fires of hell. They were awful, hard times for us, but we've changed so much by virtue of those experiences, and I think we've got valuable insights that we've shared through HPPC through the last year.
On the MCC retesting, the advice, don't need to isolate if you don't have symptoms. Is there a chance people could be asymptomatic?
Look, if they've been tested and they're very low risk, we don't think that's an issue. It's always the case that you can have no symptoms and still transmit, but we think these are very, very low risk individuals. We just want to make sure that we're not missing anyone.
On the AV Park cases, I've heard from several people who were there. Some of them have received as many as 4 conflicting text messages. They've been told they were tier 1, then they were told they were tier 2, then they were tier 1 again. They were also told, when they were told they were tier 1, that they would receive a phone call from the Department of Health. They haven't received that phone call. What's going on there?
So there are updated messages according to the risk assessment, and the Premier spoke to it. I've spoken to it in terms of what we find out about where transmission has occurred and how we therefore need to categorise those close contacts. There will be different advice that's given by virtue of those elements, and if people have been upgraded to tier 1, there will be advice. It's the first aid advice, if you like, in that text message, and we'll follow up with a phone call as soon as we possibly can. But people need to accept that advice will change based on the assessments that are made. These were individuals who were not sitting together. We think that there was a pinch point on entry into the stadium and not through the same gate. That's going to bring in a lot more people. We just need to cop that reality, and everyone who's attended needs to cop that reality as well, and do what the guidance is through those text messages and the follow-up phone calls.
In some cases, there are groups of people who... Sorry, could I just finish on this topic? In some cases, there are people who were sitting together in a group together. They entered the stadium together and they've received different text messages. Why would that be? What's going on?
Look, there are some text messages that have gone out by virtue of that time going through Gate 7. We know that was absolutely a pinch point and was a risk of transmission, so it might have been related to that, and they may not have
entered through the same gate at the same time.
Oh, look, I don't know the circumstances there, if they indeed entered the same gate at the same time, or if they had tickets booked separately and therefore had been bundled separately. But I don't know the circumstances. Right.
How many healthcare workers have been furloughed as a result of some of these big exposure sites like the MCG and Amy Park?
Look, I don't know for some of those exposure sites. There are just the odd healthcare worker through some of those Metro Melbourne sites, but Mildura's got the biggest furloughing. There's a few dozen there, but the numbers may change over time.
How many healthcare workers are in isolation because they're close contacts?
I don't know. Those
Testing. Are the numbers of people coming forward to get tested from the MCG and Amy Park matching up with the ticket sales or the attendance records?
Look, as the Premier's listed those percentages that have come through, we're at more than half for a number of those, but they are big sites and they have had expanded numbers over time. We'll see how much we get to 100% for those, but we'll be looking to try and have more than 90% of those back. But that's the numerator and the denominator. We want to see all of those test results, and we're cross-checking it against those numbers.
To reach out to those people that haven't come forward.
We're using all of the mechanisms between QR codes and the ticketing system, so they're complementary, and some of that relates to how people move about. They might have gone to the same food venue, even if they're from different subzones. So we'll use all means.
There are a number of schools that need to operate for at least 14 days in full isolation now. What's your advice to the principals about how to go about that? And perhaps maybe the Premier wants to expand on this for parents as well. As the lockdown continues, what message do you have for parents as this looks like to be an extended remote learning stint?
Look, it's particularly tough in the world of schools, and I'd call it homeschooling. It's not homeschooling. Our parents are not teachers. We are, and I include my family in this, trying to support kids who are getting remote learning while parents are trying to do parenting things at home. It is really challenging. For those schools where every student has been considered a primary close contact, yes, they're going to have to go through that full 14-day period. That's particularly tough, but they will work through the remote learning as a consequence of that. We have to drive this variant down to zero. The UK, which has got high vaccination coverage, had over 300,000 kids out of school in the first week of July just from reactive closures. We do not want a Delta variant established in the community with ongoing transmission that will do more damage to all of our activities, including schooling, if we allow it to run. That's why we are working so very hard to snuff it out now.
So when you say go down to zero, some people interpret you as meaning that you want to see 0 cases for a long period of time, even close contacts, even people fully in ISO.
No, I'm talking about zero community transmission.
Yeah.
It's the national strategy. You know, Premier Berejiklian has referenced it with good reason. The alternative is hundreds turning into thousands, turning into tens of thousands of cases. I know that there will be an ongoing risk from international arrivals through whatever breaches that might occur. There's no system that's perfect that means that we are not at risk from the international pandemic that surrounds this country, that is getting worse in many areas, including in Asia. So I'm not in a fantasy world where I'm pretending that there is no risk across the globe. There is, but we need no community transmission in order that it doesn't spark again and that we're just dealing with hundreds and thousands of cases again.
One question on the stadiums. You talked about how people have been infected who didn't sit right next to one another, but they might have met at a food turnstile or in the gate or in the Percy Beams bar on level 2.
Yep.
Is there any evidence of transmission out at the seating? And the point of my question is, has any of this transmission changed your understanding of the risk of stadium transmission for the long term?
Yeah, look, I think so. The Delta variant shows that transmission within stadia absolutely occurs. We think that there's been outdoor transmission, probably at the MCG and at AAMI. I mean, AAMI's outdoor seating. We don't know if it's at seating. We've got individuals who were not seated together. There's no evidence that they've attended a food venue together either. We think it's a pinch point going into the stadium outdoors. A lot of people reference the fact that we don't hear about transmission outdoors. I think some of that relates to the fact that you've got casual contacts. You'll never know that they came together, and so they end up as being a mystery case. When you've got contact tracing that is identifying exactly where people have been, but you know that they've been outdoors, then you're starting to pick up some of that outdoor transmission as well. It's lower risk. It's much, much lower risk, but it happens. We have to re-look at the public events framework and how we help manage that as we kick off public events down the track. Sorry, Rachel.
Sorry, can you tell us anything more about the 4 cases?
No, I've got no details other than that they're on the books for this morning, sorry.
Can you tell us more information about the second Mildura case, the age, the gender, whether they were in isolation?
No, I don't have that information. That's again, just through overnight.
And given this Mildura man has tested negative, then tested positive, how confident can you be that you won't see more cases like that come out of the MCC?
Oh, look, there are normal circumstances where someone tests negative early on in their incubation period. The point about strict quarantine for 14 days when you're a tier 1 exposure site, when you're a primary close contact, is that it doesn't matter that you've got a negative test early on. You've got that 14-day incubation period where you could become positive. That's what's happened in this case. It really is used early on in the incubation period to identify if someone's become a case, because they then get looked after as an infectious individual and their close contacts are followed up. But it doesn't mean that they can't test positive later on. For the tier 2 contacts, I do think that's different. We're talking about very low risk individuals.
Does it give you some confidence that he probably wasn't infectious during that early period, Sunday, Monday, Tuesday, when we've got those exposure sites in the Mallee and in Mildura?
Yeah, I think so. Not absolute confidence, but a certain level of confidence that unlikely to be infectious at the time of that negative test. You know, there are some tests that don't work perfectly. The Delta variant also appears to be one in which you're infectious right around the time that you test positive. And so that's another tricky element with this variant.
And just on children eventually being vaccinated, do you recommend that children be approved for Pfizer?
Oh, so whatever vaccine goes through the Australian Register of Therapeutic Goods through the TGA approval process for kids will be terrific. We haven't got any yet. If that happens with Pfizer, fantastic for 12 plus and maybe younger age groups as they go through the safety and efficacy trials for those younger cohorts. But if it ends up being another mRNA or other type of vaccine, fantastic. You know, it's protecting kids for their own sake, but also helps move us towards that herd immunity and, you know, protects you from the exit wave that I've referenced in the UK, where you get hundreds of thousands of cases because you've still got significant proportion of the population who can't yet be vaccinated.
Rewind a little bit, just back to Paul's point about crowds and stadia, and just ask the follow-on from that. Is it unlikely we'll go back to 75-85% of crowds at major sporting events because of what we're learning out of this outbreak?
I really don't know. We have to assess it. We're going through a process of what other risk mitigations can be implemented, the kind of engineering or infrastructural or organisational changes that can help manage that, but there's no question it looks more challenging than it has previously.
And just while we're on the sporting beat,
Sorry, Simon, then Laura. Well, it might be harder subzones, more entry points, more staggered entry into those arenas. Who knows what else we can or should look at? Pre-event testing with rapid antigen tests, vaccination status of individuals. That I've always said that needs to be a national consideration. We shouldn't be going out alone on that, but all of those things should be in play, I think.
And are you or the department dealing with the AFL just regarding some of the players apparently that are in the league that have been to exposure sites?
Not me, I'm not dealing with them. DJPR may well be.
And Premier, maybe could I just ask you, is the government working with the AFL on any ramifications about their season, and also how Melbourne is placed for the grand final, hosting the grand final later in the year?
I'm not briefed on any details beyond what I said the other day, which was I look forward to us getting this outbreak under control, us then getting back to having crowds at sporting events, and at a multitude of very big sporting events, of course, being held as close to normal as possible here in the major events capital of our nation. It's far too early to be speculating about those things.
Can you just explain why the Victorian government won't mandate aged care vaccinations by mid-September?
Yeah, look, there's been a bit of, frankly, unhelpful and completely inaccurate reporting about this. We don't have a Public Health Act like they do in New South Wales. We don't have a Public Health Act like they do in lots of other parts of our country. Aged care, here's a newsflash for you, private aged care is the responsibility of the Commonwealth Government. They fund it, they regulate it, they licence it. So it's a partnership that'll see all of those staff get the jab. It's not for any one state to do it, it's a partnership. I don't believe any orders have been made anywhere yet, anywhere. That was certainly the case on Friday. What I don't do is dictate what public health orders will be, because if I were to do that, under the Public Health Act as it is written now, then we might well find ourselves in court, because that would not be an appropriate process. So I wouldn't read anything into that. It's a matter for the Chief Health Officer, and he's not going to speculate about it here at a media conference. He's going to thoroughly consider all those options, and then he's going to weigh it up, and he's going to make a judgment that's in accordance with the law so that it's challenge-proof, if you like. I find it offensive, frankly, that people would be speculating, anyone, that we were anything other than committed to keeping people in aged care safe. We know as a state what it's like when this gets into aged care. It got into private aged care. We were able to avoid those tragedies in public sector aged care, the beds that we run. But we know, all of us, the tragedy and the great toll that this virus took on aged care residents. We know that and understand that. That's something that's very, very personal for every single Victorian. So we take those matters seriously, and any suggestion to the contrary is just wrong.
Given that, as you say, private
Sorry.
Do you think that mid-September timeline is achievable?
Yep, and we're absolutely signed up to that. This is a debate about how you do it and sort of paperwork, and we'll get it done. We'll absolutely get it done. I would have thought a bigger challenge might have been whether we had enough vaccine to get it done, not the orders under which it's done.
Given that, as you say, private aged care is the responsibility of the federal government, are you saying that they should mandate this, not the state?
Well, at my urging, the Commonwealth Government, again, I don't speak about what happens at National Cabinet, but to be clear, I've been asked the question. At my urging, repeatedly, the Commonwealth Government are going to use their unique relationship as a funder, as a regulator, as the licence giver. Like, all these funded beds are a gift of the Commonwealth Government. The accreditation and licensing is done by the Commonwealth Government. They are uniquely placed to make sure that every player in private aged care, large and small, for-profit and not-for-profit, take these matters really seriously and do everything they can to get their workforce through that vaccine program, and to deal with, for instance, the the percentage of staff who will not be able to present to work the following day because they'll be a bit off colour because of the vaccine. All of those issues, I'm not in a position to manage those, and I try not to make rules that are not lawful, and I try not also to make rules and then when I know I haven't got the capacity to enforce them. It's a big sector and it's run by the Commonwealth.
Can I please just clarify two things? One on vaccination, one on business support.
I'll certainly try.
Thank you. Business support, obviously this is going to go for longer than 5 days.
We'll have more to say.
And what about the ones who haven't qualified under the current conditions?
I don't see the criteria changing as such. And I don't think anyone would not have qualified because of anything we had specifically done as a result of this 5-day lockdown. But I'm happy to look at any specific examples you've got. In terms of when we have to go longer, then we will look at, within the context of those details, which are not finalised now, but they'll be finalised tomorrow, we'll look at whether there's more that we can do, and I would foreshadow that we will do more for business.
And
and your second issue?
Over the weekend you said less than 1% of vaccines being wasted. One of our reporters last night was offered a vaccine outside of Jeff's shed because so many people didn't turn up to be vaccinated. Can you just reiterate what that problem looks like? Where are some of the worst areas? And ultimately, are you happy with the idea that just random people off the street are being asked if they'd like a jab?
I don't have any specific advice on wastage rates. The point I made yesterday, others may have gone into the 1% thing. The point I made yesterday, or maybe the day before, was that we don't draw the vial until the person's there. So the notion that someone doesn't turn up doesn't necessarily mean that that dose is wasted. I think it is only natural that program is a little bit unsettled as a result of the fact that we've got people locked down. There will be people who don't, on any given day, even when we're fully open, don't turn up for their appointments. There's a booking system. That's always, there's many reasons why someone may not turn up. I'm happy to follow up on that for you and get you any details that you want about that. But I'm certainly not briefed that there's a significant problem there. But I do think that it's important to follow it up, and we will. But I don't know that we can necessarily look at these last 4 days and see them as absolutely indicative of what's going on in the vaccine program more broadly. Lockdown may have had an impact on that.
And so will you be offering a subsidy for childcare and kindergarten as this lockdown continues?
I'm not here to make any announcements about any further subsidies that we will provide. We will do that in the context of our announcements tomorrow. Certainly, you absolutely can.
We found out about Miss Frankie and F45 in Richmond 3 days ago. The next day we were told about another restaurant, and then on Sunday we were told about Coles. Late last night we were told about Precinct Hotel and Bastion Collective. Do you know if these are linked to the same person?
I'll take that on notice. There's a lot of information there. I'm not sure if it's all the same person, but can come back to you.
If it is the same person, how has it taken over 48 hours then to
I'll come back to you with the details.
Professor Sutton, do we have enough contact tracers? We've seen an email recruiting for a contact tracing position.
We'll always be recruiting contact tracing positions. There's a natural turnover for some staff, but we've got enough. We're working within capacity. The time frames for the case interview, the isolation of contacts and the contacts of contacts is working fantastically well, but there'll always be recruitment going on.
Professor Sutton, if we can cast your mind back to March and April, might seem like a long time ago, restrictions were quite, loose or light back then. Obviously, we didn't have the Delta variant in Australia at that point. Do you foresee going back to that before everyone's fully vaccinated, or does Delta change things?
Look, I hope so. Of course, we just need to see what the risk profile looks like across the country when we're out of this. We all want the freest life that we can safely get. People will always feel frustrated by recommendations or mandates for mask wearing, the limits on various venues. We don't want any of that to be in place more than necessary. But we keep getting reminded of the risks and how they emerge. And I think the transmissions that we've seen just in the last week tell you that we need to be on guard in so many places ongoing. I hope that most of that can be managed through the least restrictive measures possible, but it's not a case of pretending like the risk doesn't exist. It will carry on for some time until we've got that very high vaccination coverage.
Does 5 days ever realistic to get control of these outbreaks?
It does sometimes, and clearly you have circumstances where that initial case only passes on to household members. It all gets contained. You know, the lockdowns that happened in WA, Northern Territory, Queensland, with the Delta variant, really only saw transmission in very limited circumstances. If you start with a super spreader event, or if there are people in an apartment block who are multiply infected, you've got a different challenge on your hands. But you can manage that sometimes with a short, sharp circuit breaker. When it doesn't do enough, you need to reconsider.
Parents at St Margaret's Grammar in Berwick were sent a letter on Saturday saying that a community member had tested positive and the school would be closed. There's been nothing more in press conferences or in exposure sites about that school. Can you clarify what's going on there?
I don't have the details. Happy to look into it for you, Rachel.
And any information on a positive case at the South Melbourne Primary School? Do you know?
No, nothing yet.
We just had some questions for people in Tier 1 exposure sites isolating for those 14 days. Can you just clarify what the rules are around what days they need to get tested?
So there'll be a prompt from the Department of Health. I think it's within the first 3 days, and again right at the end of that quarantine period, day 13. But I can give you the specifics.
And just on your conversation with Professor Chant, did she call you or did you call her? And I guess what advice did you offer her?
Oh, look, I won't go to the specifics of it. We were put in touch over a phone call. And really, it was a conversation about any particular challenges in New South Wales, any particular reflections that I might have had about how Victoria could help, or lessons that we might have had historically. New South Wales has helped us through tough times last year. We are here to do whatever we can in return.
Was that conversation before or after they decided to toughen their lockdown?
It was before. No details yet. They are just hot off the press.
Have you seen the VCOS ad or the Melbourne Symphony Orchestra ad encouraging people to get vaccinated?
I have. Terrific ad. The idea of a positive motivational ad is terrific. As the Premier's suggested, there's not great hesitancy. I don't think we need to push people to vaccinate. There's a lot of people who are ready to step up. But something that frames it in a way that makes people see exactly the world that we're trying to move to is a good thing. Right.
Any other issues?
Premier, just a quick one from the construction industry. Sure. They're worried that they may also be shut down, similar to New South Wales, to get a handle on these outbreaks as our lockdown continues.
I wouldn't be guided by the rule changes up there. We've made announcements already. I don't believe we're looking to tighten things. It's about the duration of the current measures. That's what tomorrow's about. I can't rule out that we'll look at other things overnight, but I wouldn't be guided by what's occurring there. Again, I wish them well, and because if they've got a problem, we've all got a problem, right, across the whole country. We have a chance to avoid that, and I'm very confident we will, because of the steps we've taken and because of the amazing job that the people of Victoria are doing. They're following the rules, they're doing the right thing. This is really tough, but they know there's no choice, there's no option. And I just go back to the fundamental point. We are shut down to put this out. We're not shut down to avoid or to just preserve our health system. We've got a chance to do something much bigger and better than that. But I would have thought, hopefully it's beyond doubt how fast this thing moves now. Everyone knows it. Strangers within hours, it's the time we get to them, they've infected everyone they know, all of that sort of stuff. That's now beyond any kind of doubt. What's also sadly beyond doubt is that if you are not vaccinated and you get this Delta variant, a large percentage of people finish up really, really sick or could do. And we don't want that. We don't want that to happen. So again, just where we started, good news today. Small numbers in the scheme of things. A growing trend about people being in ISO during their infectious period, but it's too early. We need more time, and we will make announcements tomorrow about exactly how much time we need. And people can be confident that that's based on the best advice with the best and most complete picture, looking at the results of testing rather than having thousands of tests in the lab. It's just the best way for us to do it. If there's no other issues, thank you all, and we will see you tomorrow.
Thank you. Thanks, Brett.